Hi, my name is Reagan Dyke. Today is November 20th. I'm a pre-nursing major and I'm going into nursing. So the first topic that I thought was important is knowing about the brain. And this is important so I can give better care to my patients and just be more knowledgeable. So for example, if I know that their language is not working the way it should be, then I know then that would be like the Wernicke's area, which is affected, which is like commonly affected by strokes. And so like I can piece all of those together and that would help me a lot. And so parts of the brain it's important to know are like the prefrontal cortex, which is like your cognitive control, your personality, problem solving, attention. And then the cerebral cortex is like higher level processing, which is very similar to the prefrontal cortex. And then the limbic system is feeling and reacting. It's like your emotions, your memories, not, yeah, emotions, memories, and that type of thing. And then the brainstem really just keeps us alive. It's like the things you don't even think about. And yeah, those are some of the important things. So the next is addiction and dependence, and this will be very important to me to keep in mind because like so many people will like take a chance. Like if they have a chance to abuse drugs, like they will take it. And so it's just going to be really important for me to like be careful with who gets what medicines and just so that they're used for the right purpose. And so drugs, whether they're like stimulants or depressants, they can increase or decrease the functioning of the nervous system. If it decreases it, it can like depress the frontal lobes, depress the cerebellum, and depress the hippocampus, which all of them are very not good. And so if someone is addicted, um, it's it's not good. The frontal lobe shrinks, which leads to more reactive to stress. And then psychoactive drugs influence mood, behavior, and thoughts. And so most of the time when people are like so addicted, the reason that they go to such great lengths to get all of these medicines and drugs that make them feel differently is just because like they don't find life rewarding anymore. And a lot of times like when they try to quit doing the drugs, they relapse just out of desperation to feel something. So that's something for me to just keep in mind and like think about. So next is phantom limb syndrome, and this is going to be important for me, like to be mindful of and to think about, and just like to be understanding of patients, the amputees who like lost their legs, lost their arms, maybe a finger. It's just going to be really important for me, so I can think of ways to help them relief. Like if they have an itch on their leg, maybe I can use like the mirror box theory technique, and they can itch the other leg, and it tricks their brain. And so, yeah, so phantom limb syndrome is just the ability to feel a limb or body part even when the patient knows that it's not there anymore. So, prenatal development includes organogenesis, and this is when you're pregnant, and it's when all of the organs in your baby's body are forming. So, like heart, lungs, brain, all of the little systems are forming. And then the age of viability is 22 to 24 weeks. And this is when it's considered like an actual baby. So before this point, it's called a miscarriage, and after it, it's a stillbirth. And then teratogens are anything that decreases like human development. So this can be emotional state, drugs, chemical, alcohol, cigarettes. And so all of these are going to be important for me as a nurse because a lot of people don't know about this. Like emotional state, many people don't know that like that's going to impact your baby. And so a lot of the stuff in prenatal development is just going to be informing the expecting mothers. And then gender is also going to be very important for me as a nurse. So I can avoid bias at all costs and help one to just feel their best, be the healthiest they can be, mentally and physically. And it's also going to be important because when some babies are delivered, sometimes they don't have like clear genitals. And so I'll be working with that. And so gender identity is the personal and internal opinion of your own gender. And then being transgender is gender identity that differs from the sex assigned at birth. And so, yeah, this is how it's important in